We welcome you to this afternoon Zoom media availability with Multnomah County Public Health Director Jessica Guernsey, the Regional Health Officer Dr. Jennifer Vines, the Washington County Health Officer Christina Baumann, and the Clackamas County Health Officer Dr. Sarah Present. So what we're going to start with are very few remarks, and then you'll all have a chance to ask some questions. It would be a little bit helpful if you could just even put your name in the chat as we start the questions, so we could go down some kind of a queue, so we're in some sort of a organized fashion and it's not a free-for-all. Other than that, I'm going to let Director Jessica Guernsey go ahead. Thank you.
Thanks, Julie. Hi, everybody. My name is Jessica Guernsey. I'm the Public Health Director at Multnomah County Health Department. And we're here today to make sure people have accurate and honest information about the status of COVID-19 vaccine in the metro area. And before I say a few things, I just really want to acknowledge we're actually on the cusp of a year of being in, really what I can only describe as a horrifying pandemic. And now we have hope on the horizon with the distribution of a COVID-19 vaccine that we are working very hard to get out into the community. I know people in Multnomah County and across the state have worked very hard to make sure our COVID-19 hospitalizations, illness, and deaths remain some of the lowest in the country. And I can't thank people enough. And I know that the frustrations that we're experiencing around the distribution of the COVID-19 vaccine have been extremely frustrating. So I really want to acknowledge how difficult the last few weeks have been. There's really no easy way to say this. Right now, we're in a situation in the metro area where we have more people eligible for the vaccine than we actually have vaccine in the metro area. As I said, this is an incredibly frustrating situation. I share people's frustration as somebody who's been working in the response, as a daughter to a 75-year-old mother that I'm worried about, and my friends and family in the community. I'm sorry for any distress that this has caused. Just to give a little bit of a background, I know folks got a press release, but to give some context, on January 12th, the metro area went live with a survey link that linked people that are eligible for the COVID-19 vaccine in phase 1. Employers, sole practitioners, and other organizations and groups that represented more than 60,000 eligible people applied for vaccines through this survey. We were able to send invitations for vaccination to about 11,000 people, but with limited vaccine supply and a shifting understanding of how much vaccine we would actually get. And now the move to add more people that are eligible for the vaccine in the governor's framework for vaccination, there is a high likelihood, a very high likelihood that many people in the 1A group will not get an appointment or receive their first dose for weeks. Once others who filled out the survey may have to wait for months before they're vaccinated. And because of this very frustrating situation, we're closing the regional survey today for the 1A group. And with that, I think I'll open it up.
So if reporters, we're going to ask the health officers and public health director Guernsey to go ahead and respond to you if you want to go ahead and start. Kristen Severance from KGW, please.
Thank you so much. So we all know that you did the news conference January 12th. All of us covered the news conference. We told all of these people to fill out the survey. You knew pretty early on that day that Governor Brown was opening up the priority group to include teachers. Why did you not update people on this survey until now? Why did you allow thousands and thousands of people to keep filling it out without any update?
I can take part of that. We worked very hard. We're working in partnership with many different people on this project, the metro counties, hospitals, and the state. We worked very hard with those partners and the state to figure out the best ways to mitigate what was happening before getting to this point. But to be totally honest, we were not able to come to a solution that would actually deal with the number of people that we were talking about. We know folks have heard statewide that the state is close to finishing the 1A group. That may be true for other parts of the state, but it is not true for the metro area.
And this is Christina Baumann, Washington County. We know that the people that signed up on this survey expected that they'd get the vaccine in a timely manner. Local public health and the health systems had exactly that same expectation. And now, with the shifting situations, the shifting policies, we are seeing that it's very clear that timeliness is not going to be probable for this group.
Pat, do you want to go ahead? Pat Torres?
Sure. So my question is in regards to the state holding back 50% of the supply that's sent out. And they're holding it back to make sure that there's a booster dose, but you could certainly be vaccinating a lot more people a lot faster if you didn't hold that back. Do you have any thoughts on that?
I can take that. This is Dr. President from Clackamas County. The recommendations for fully vaccinating each individual is to get the 2 shots. There is a lot of international as well as national debate on the timing of that second shot, but we do know, based on the biology of the vaccine, that that second dose is important to provide full immunity and the full immune response from the vaccines. So we are sticking to a priority of ensuring that everyone who starts the vaccine series is able to finish the vaccine series. And I think that that is something that we can all agree on.
Lisa Balick from COIN. Lisa, are you there?
Yes, thanks. Question for you folks. Do you want the governor to put on hold her decision to have teachers start in getting the vaccine right now?
I'll take that. Hi, Lisa. It's Jennifer Vines for Multnomah County. I think that those wheels are turning now to get educators through. I think the governor was really clear around her priority of getting kids back in school, and she made the decision to make vaccination of educators and childcare workers a part of that plan. So that plan is unfolding literally as we speak.
But are you going to request or ask that that be put on hold because there are thousands of healthcare workers, the ones first in line, who don't have the shot?
We've been in conversation with the state really at all levels about this situation with vaccine. We've made clear the situation that we're in. To my knowledge, we don't have any plans to formally request that the governor pause her phasing plan.
Would you like to see her do that?
I think there are different ways to prioritize vaccine, which unfortunately has now become a scarce resource. You can prioritize it based on function, which the governor has chosen to do, or you can prioritize it by risk. And we all know very well a year into this pandemic who those risk groups are. So I think we are just eager to see vaccine rollout go smoothly and get back to the phase 1A, the people who are supporting the vaccination and healthcare infrastructure, and get on to the high risk groups, which is really the older age groups.
Amelia and Lisa, I'm sorry, I think you might have been at the front of the line. I accidentally pushed you down, but Amelia Templeton from OPB.
Yeah, 2 questions. First, the 11,000 people that you were able to give appointments to, was that first come, first served, or was that based on an assessment of who most needed the vaccine among everybody who applied?
Sorry, can you hear me?
Yes,
ahead,
we can.
Yes, we were able to do some stratification within folks that applied based on an equity lens and need, which is something that each county strives to do in all of this work. So we were able to work through some of that list and offer up slots for people that were perhaps going to have a harder time getting vaccine, including folks like community health workers, medical interpreters, and others.
And then sort of related to that, there's, Oregon has had a very broad definition of health worker in the 1A group, and it has included some people that have very little risk of exposure to COVID-19. can you give me a sense of the people who aren't yet vaccinated in Oregon or in Multnomah County, Clackamas County, and Washington County? Who are the biggest group that you're worried about? Is there anyone in this group that's really at risk of exposure to COVID-19 through their work?
So I'll just comment that in the press release, we do have a listed out of what our public health phase 1A priorities are, starting with adults with intellectual and developmental disabilities and other medical conditions that require in-home care services. We know that these, we are looking at risk of severe illness and death. And so I would refer you to the press release for that full list, but we have been inviting opportunities for vaccination along with that prioritized list based on risk of being exposed during the worksite.
Genevieve from K2.
Yes, thank you for taking the question. I have two. I have some from my colleagues as well, but I would like to ask in general, and if we could have everyone respond to this, how would you rank the state's distribution of the vaccine at this point in time? Is it where you expected it to be? And if not, where do you think the state should be?
I'll start with my response to this. This is Jennifer Vines for Multnomah County. I think it's amazing to me that we have vaccines with this effectiveness and safety profile, and that we had it by the end of the same calendar year in which we had the first case of this virus. So that is incredible news. On the other hand, as you can imagine, today is a very dark, low day for us to have to announce this discrepancy between supply and demand. So I think in general, our expectation was to strengthen the healthcare infrastructure that we've worked really hard to protect this last year, and then move quickly to vaccinate people who we know to be at risk based on our local information about who the cases have been, who the hospitalizations have been among, and unfortunately who the deaths have affected. So I think the announcement that we weren't getting nearly as many doses from the federal level as we expected was very difficult. And unfortunately, here we are again on a difficult day. And acknowledging the desire for people to be vaccinated, the relief that comes with that protection, and having to ask people to continue to be patient as we work through the state's framework with the supply that we have. And I'll let others share their opinions as well.
Sure. I'll speak to that. The distribution of the vaccine is challenging in that we and the state do not know how much vaccine we're going to receive with very much lead time. So the planning around that and the adjustments around that are extremely challenging. I also think another challenge that faces the Tri-County area is that we are a very large region with a very large population and multiple health systems and public health systems that we're working within. So one thing that has been extremely encouraging is the level of cooperation that we've had with our health systems and among public health members to do this really incredible lift of vaccine distribution in the environment that we're in.
Well, and this is Jessica again. I don't know that I could rank it per se, but I would say for us right now, to build off of what both Dr. Vines and Dr. Baumann have stated, I think we're at a point where we really want to be very, very transparent about where we're at, because I think a lot of people are hearing eligibility as equal to immediate access, which is just not the case. So I think one of the reasons we wanted to speak, today is really to make sure that people understand that we know that folks have been given the message that they are eligible either now or in the next several weeks, but that does not mean that we're going to have vaccine on hand. So we're trying very hard to manage those expectations, but want to be very transparent around what people can expect.
Dr. President, would you like to?
Sure. I think that all of those comments are really cover most of what I would have to say as well. I think that Oregon, as far as other states, is doing very well. If you look at the vaccine distribution that Oregon is doing compared to other places in the country, I really want to give a lot of credit to our public health system, to our hospitals and healthcare systems. I think we are getting vaccine to people who need it. I think the real concern here today, as Jessica commented on, is being really transparent around vaccine availability for those who are eligible. And while I don't disagree with any of the prioritizations or the ways that this is doing, we just need to be clear that the metro region may be on a different timeline than other counties in the state of Oregon. And that's why we want to ensure that we have the accurate information for people here in this area.
And so a follow-up, if you guys are saying it's going to take months for some people in group 1A to get their vaccinations, how long are you anticipating it takes for the state to reach herd immunity?
So this is Jennifer Vines. I think the herd immunity target that which refers to this notion of enough people in the community with protection against this virus, that if the virus gets introduced, it basically has nowhere to go. And so even those who are not protected are unlikely to get sick. I think it's a moving target around the threshold we need to meet for herd immunity. I am thinking sometime this calendar year. I think our focus is going to be on these priority groups that the governor has already laid out, and getting to them as quickly as we can, but with the patience and flexibility from the public to understand that the metro area is not like the rest of the state in terms of our population, and the allocation of actual doses from the federal government has been lower than we expected.
And a quick follow-up to that, Dr. Vines, I know you mentioned OHA, and at the beginning, OHA was mentioned that there's this discrepancy between how the state is doing with 1A versus how the metro area is actually doing with 1A. Has there been complications or troubles working with OHA? Why is there this discrepancy?
I mean, this is Jessica. I mean, part of it is really simply a math issue. Really comprehending the size of the populations and how much vaccine we're actually getting. I mean, that's what we're seeing right now. That in addition to, we've moved on to another priority. So that is honestly aggravating the situation that we're in right now, specifically for the 1A group.
Okay. And then the last question I had from a colleague here has to do with schools. We've heard that Clackamas County Health told schools to hold off because the numbers were on the downslope and they wanted to keep it that way for now. Do any other counties, would they like to see school districts wait on reopening so we can see the cases go down here?
So this is Dr. President with Clackamas County. I have not specifically asked the school systems to wait. I've been in close conversations with our school systems, and the blueprint for reopening schools, the metrics for reopening schools have become advisory and not mandatory. So I have been working closely with our schools to determine when reopening is appropriate, but the decision is up to each individual school district and school administrator. Public health is supporting them in their decisions. I have advised to follow the advised metrics, but it is up to each individual school administrator, school system to decide when to go ahead and reopen. I do see that our case numbers are going down significantly, and I think we have several schools that are working on plans for reopening, and the plans for reopening are really based on their blueprint plans for safety that they filled out and have been working on throughout this year. And so a return to in-person learning for elementary school is going to be dependent on safety protocols, social distancing, masking, small cohorts, these safety plans that we have been working on for quite some time. And we feel confident that when the time is right, our schools will be following these protocols to make it possible to have in-person learning.
Do you think the timeline that Governor Brown gave with February 14th is realistic?
Again, the decision to open schools or to increase in-person learning is the responsibility of the school systems, not in public health, but public health is happy to work with schools on managing any cases or outbreaks that may happen in the schools.
Genevieve, I'm gonna go ahead and move on to give some other reporters a chance. Andrew Thane from the Oregonian. Andrew, would you like to ask a question?
Thank you. So how many people are we talking about here in Group 1A who haven't been vaccinated? I know I've seen this number of 60,000 eligible for the survey. Is that the number that we're talking about, or what is the precise number and estimate of the people in 1A who haven't been vaccinated?
Go ahead, Christina, sorry.
Oh, sure. This is Christina Baumann, Washington County. I think part of the challenge is that it really is hard to get a clear sense of the numbers. The prioritization was written for 1A, the guidelines were written fairly broadly for some groups. And so enumerating them has been challenging. Finding them has been challenging. And that was part of the motivation in opening up the survey, because we knew that we did not have eyes on and connections to every single person that fit eligibility in phase 1A. And so we were asking them to self-identify. So the survey itself is an estimate, and it opened a couple weeks ago. We know that since then, some people have received access to vaccine either through the invitations that we connected them to, or may have received vaccine through other opportunities. So it is hard for us to say exactly how many people that signed up on the survey have already been vaccinated versus are not. We do know that the longer we left the survey on, we still had thousands of people signing up. So we know that the need is great and has not been met. How big the denominator is or how many people have already received vaccine is really hard to say, but we know it's thousands, tens of thousands.
Okay, and so educators in the state's largest school district were able to sign up today at noon. Are those people then, they're going to be ahead of the line, right? And these folks we're talking about who are responding to these surveys, they're going to be behind people at PPS and other school districts. Is that accurate?
Correct.
Okay. You know, I know we've talked about the metro area being different, but, you know, just in the last day, we have at least 4 counties that I know of have started vaccinating seniors. Has there been any discussion with the governor's office or any other counties of some type of reallocation of existing resources to meet the need in the metro area?
This is Jessica. I mean, I think that's definitely one way to approach this. Looking at our population size and complexity. Again, we've all said it, and I know people, you know, get somewhat tired of hearing it, but the metro area is different. We're a major urban area that has large percentages of those population. So I think that is one way that we could solve this problem, is to think about a reallocation that allows for us to complete more of the populations that the governor has prioritized.
Is that statement, is that an acknowledgement those conversations are happening?
We're talking to the state all the time about how to solve this together. That's one thing that we've discussed. We've discussed many other options. I think we're all honestly trying to get to a solution, and there isn't an easy way to solve it for a state like Oregon with the challenges in the vaccine inventory that we have.
Sorry, one more and then I'll move on. I mean, everyone on this line has heard stories. Basically, it's almost like it's who you know is how you can get a vaccine, it seems like, in some regards. What would you say to, you know, people in the metro area overall who might not be in one of these groups, but have the means to be vaccinated? Because it seems like that exists right now, and almost like I hasten to call it a black market, but you are able to get appointments and vaccines right now. What would you say to people who have that at their disposal?
This is Jennifer Vines. I would say, you know, people are smart. People want the vaccine. There can be ways around the framework that we've set out and the new state link that was in our press release that's going to work to prioritize people hopefully more smoothly. I think I would urge people to be patient, to recognize we're doing the best we can. We understand everybody we hear from wants to get vaccinated and wants to know when and how that's going to happen. We don't have answers, but we're working really hard, nights, weekends, to figure it out. And I think I would also just point out that we don't want to waste any doses. And so there will be stories of people who find their way to a leftover dose and who get vaccinated and tell their friends about it. That's in the spirit of not wasting any dose. And we're getting better and better at planning for prioritized groups to get every last dose in the vial, but you can certainly find stories of people who got vaccinated that way.
Thank you.
If nobody else, before I have reporters ask a second or a round of questions, I'd still like to get through the original list, and we have Rachel Monahan from Willamette Week. Rachel, if you'd like to go ahead.
Hi. So I'm not sure why it's an awkward thing to ask the governor to give the Portland area the equivalent amount of vaccines. What is the math here on why you're saying sort of, but indirectly, that Portland isn't getting the Portland area isn't getting its fair share of doses relative to other areas of the state? Please explain the math. Is it that we have more hospitals and therefore more doses need to go here because our hospitals are caring for people in other parts of the state? Like what, like, I feel like you could be less opaque here, even though it seems like you consider it politically unwise for you to be direct on this.
Yeah, I mean, I think you're right. I mean, we definitely, with the healthcare population, healthcare workers, and some of the populations in 1A, and certainly with educators, the proportionality in the population is magnitudes of difference than the rest of the state, and then the complexity of the area certainly overlays additional challenges with the regional work that we attempt to do. I mean, if I sounded like I was mincing words before, I'll try not to mince them as much. I think one way to solve this situation is to allocate more vaccines to the metro area to match the level of population and complexity. The state would have to make that decision.
I'll just tag on to this. I think with the scarce resource in this scenario, we're trying to be mindful of not falling into urban versus rural or teachers versus grandparents. A lot of people want and deserve this vaccine. They deserve to get it in a smooth and timely way. And we are working really hard within the constraints that we have to make that happen.
I think it would be helpful for everyone if you explained how vaccine distribution is happening, because right now, because originally it was allocated to private, healthcare providers, the hospitals, along with nursing homes. How is it working now? Or to, and to like some public, first responder agencies. Can you explain how distribution is happening now? Is it the same way?
So it's been a changing landscape. I'll try and explain it as best that I can. Initially, we received the Pfizer vaccine, which, as you probably know, has very specific storage requirements, ultra cold freezers. The rationale behind giving those first doses to the hospitals is that they had the capacity to use that and also had the workforce that was prioritized to receive the vaccine. In addition, as more vaccine became available and the Moderna vaccine was being given to the states, clinics, potential vaccine providers that were large, over 100 staff, were asked to register to be vaccine recipients and providers. And so some of those entities did receive vaccine. So initially, with the vaccination of the phase 1 healthcare workers, those entities were able to provide vaccine to their staff more easily. The challenge was everyone else that was not connected to a health system or a large clinical system. and wasn't directly receiving vaccine. That is why the local public health in the Tri-County area came together with all of the large health systems to talk about this and how to create access for people that didn't have direct access. And that's how the survey came about. Now, with the collaborations with the health systems and the standing up of the mass vaccination sites, this is a different landscape. And so vaccine is being allocated by the state to those mass vaccination sites in the hopes of vaccinating more people more quickly. So that's part of the distribution rationale and how it's been changing.
So is vaccine still going out to smaller clinics or smaller agencies aside from the mass vaccine clinics?
Again, it's been changing. Some allocations have gone to local public health and to some other clinics in the past few weeks. We don't have good information on what allocations are going to be to the smaller systems over the next few weeks.
Thanks. If we can, thanks, Rachel. We can move on to John Hendricks at KPTV.
Kind of touched on this a little bit, but how many doses are coming into the Tri-County area each week? And is it proportional to the population compared to other counties? And then has the Tri-County area seen the number of vaccine allotments changing to go to other parts of the state as they open up max vaccination clinics?
Could you repeat the first part of your question, John?
Just curious on how many doses are actually coming into the Tri-County area each week, and if it's proportional to the population.
I believe this week between educators and the 1A slots that are available, I believe we're close to 15,000 doses. Is it proportional? I actually can't answer that with accuracy given where we are right now.
Is that 15,000 for the whole Tri-County area for this week?
That's my understanding, correct.
Okay, and then another quick question. How do you tackle or learn from what's been happening when you have to tackle these larger populations and age groups when you eventually get to that phase?
Yeah, this is Jennifer Vines. I think the irony here is that we spent the first part of January figuring out how to do high volume, high throughput clinics, and our health system partners really stepped up with that. Unfortunately, now we're left with not enough vaccine to fill all those clinics. So my biggest hope is that the vaccine doses will start rolling in and we will be ready to get shots in arms.
Can we hear from Lynn Terry at the Lund Report?
Yeah, hi. I want to follow on John's question. So you're getting 15,000 a week. How many vaccines have you, doses have you gotten to date, and how many have you administered in the Tri-County area? And I have another question after that that's unrelated. And then how many? What are you expecting for like next week and the coming weeks? Are you expecting that 15,000 to go up, to remain flat? So just first of all, a data question, and then I have another question.
Just to be fully transparent, part of the challenge here is that we do not have a way of anticipating what is coming more than 1, potentially 2 weeks ahead. And I think that that may be related to federal distribution plans, but we have definitely been talking with our partners, and I know that there's a goal to have an anticipation at least 3 weeks in advance of how much vaccine is coming. But so far, it really has, it's been somewhat unpredictable how much we are getting, and it's fairly on a week-by-week basis. So we cannot say that we are assured that we're going to get the same amounts moving forward. What we have been assured about, and I can assure the community, is that we will be getting second doses for those who have received first doses. So there's a separate second dose allocation that will match the first dose allocation that happened 3 to 4 weeks prior.
So, yeah, there was the other part to that. How many doses have you received and how many have you allocated to date for the Tri-County area?
Lynn, I think that's a good question. I don't think anyone on this call is prepared with those numbers. We'd have to tabulate across all the health systems and clinics and various other sites that received vaccine, but we can try and get you that information.
Okay, that'd be great. So the other part of my question has to do, so you had 60,000 plus 60,000 plus leap onto your survey in a few weeks. You've been able to invite 11,000. And so what I gleaned from your press release, and please correct me if I misunderstood, those people who weren't asked now are being referred to the OHA tool. Is that correct?
Yes, that's correct.
Okay. So those people who haven't been asked referred to the OHA tool, which you know, I tried it yesterday when I found out about it, and it walked you through the eligibility questions, and then it threw you to a county page, which was a dead end. And today I've tried it and it doesn't even work. You did include in your press release that, you know, it's got limited capacity, but, you know, it's like these people who have already signed up now are not going to be able to sign up unless they hire a fleet of people to be constantly refreshing their computer screen. So, you know, what are your thoughts about that?
Yeah, I mean, honestly, that's why we wanted to come and talk about this today. It's not going to be a perfect system. And we're trying to move from, you know, what we did before with the survey to a system that we're working in collaboration with the hospitals and OHA on, and it is going to have problems. It's going to have problems in terms of its capacity and ability for people to get through, and it is a less than ideal situation. So, you know, I was when I, you know, opened the statements this morning, I don't want to minimize people's frustration. We're in a situation where we're going to have to do real-time quality improvement to make this work better. The first piece didn't work as well as we wanted it to. A lot of that had to do with, like Christina said, Dr. Baumann said, our understandings of what was available to us in terms of the number of vaccines, which is really what became the problem with the survey, not the survey itself. But now people are going to experience frustration, and we're going to be working closely with our partners to make that you know, we're going to work to make it better as much as we can. But right now it is going to be difficult.
So why isn't there a wait list? I mean, that's a really simple solution to all of this. You know, you have a wait list and then you go one by one and you gradually, you know, get everybody. Why did no one think of that?
I think, Lynn, this is Jennifer Vines. I think the real bind that we're in here is a lot of phase 1 eligible people still waiting for vaccine, pause while we follow through with the governor's expectation around vaccinating educators and childcare workers. And following that, the governor has conveyed that people in the older age groups are eligible. And from a public health standpoint, we are eager to get to those people. We do know that they are at higher risk of severe disease, hospitalization, and death. So to pause those high-risk groups to go back and vaccinate tens of thousands of phase 1A workers puts us in another impossible situation. And so I think for now, our goal today is to be honest about where we are with phase 1A and to start to prepare the public that vaccine may very well roll out much more slowly than we originally had hoped.
Okay, I mean, I don't want to dominate this thing, but so with seniors coming on board and 750,000 seniors, not in the metro area, obviously, it's going to be a pile-on for months, correct?
Yeah, again, this idea that eligibility means that, you know, it's your turn to smoothly log in and, you know, get your vaccine appointment. That is simply not the case in the Portland metro area at this moment, and it may be weeks, if not longer, until that is the case. And we are taking this really seriously and doing the best we can to match expectations with what we can actually do in terms of our vaccine doses and supply and partners.
Thank you.
We are keeping some amazing people here before you. I know that there was a little round of follow-up. If everybody could just briefly, there's a question at a time. We have time for a couple more questions. I'm gonna let Kristen ask another one, and we'll try to get through. If you don't get a follow-up question asked on this, put it in writing, and Kate and I will try to get a response to you. Kristen, do you want to take one more quick shot?
That's so nice of you. I did not say I wanted a second question, so someone else can have mine.
That's great. Lisa Balick is asking, can you say what people who qualify on that 1A should do now? Should they go to the link? And so the answer is yes. People are nodding yes. And also, if anybody could potentially hazard a guess toward what this might mean for metro area teachers.
I'll start and others can chime in, because I'm just going back to what the governor herself has said, which is that there's actually not enough vaccine expected or set aside to vaccinate all educators in the state, but only I think a majority of them. I want to say somewhere around 85%. So that's yet another reality that we're going to have to contend with these next 2 weeks as educators and childcare workers are eligible and have access to vaccine, and others may know more than I do.
Yeah, I'd like to talk to the educators for a moment. I know that many of the school districts and many of the schools are looking to prioritize their educators as to who is going back into in-person learning and who is providing services for the high-risk students who do need that in-person learning. So as long as there continues to be remote learning, we would ask that those educators do wait and let those who are in person working, especially with the higher risk students, have the first prioritization in the vaccine. Again, that's really up to, we're asking the schools to consider prioritizing their staff that way as far as sending them to vaccine appointments.
Yeah, and just to build off of what Dr. President was saying, the schools have worked really hard to stratify the groups that they are sending forward, with the understanding that there is not enough vaccine to vaccinate everybody in those groups. So they have worked really hard to stratify groups across educators and staff that are at risk of becoming ill, including folks like bus drivers, food service workers. And then there's also folks that are working within the childcare community. So they've worked really hard over a very short amount of time to stratify who to get in first. And I think, part of that though is really asking people to have a social contract with one another, given that we're in a scarce resource situation. We're taking time to do these risk stratifications and reach out to specific people, because we don't have enough to get to everybody, but that really requires that other people try to remain patient and let those folks get in line first.
Amelia, would you like to follow up with one more?
Yeah, I guess I'm struggling a little with, I think, what Rachel was getting at, which is that we can't see the math. So it's really hard to know if what you're telling us is true, or if Multnomah County has just used a different, definition of who's in 1A than other counties that have hewed more narrowly to certain, groups of health workers. Anyway, I'm just wondering on the sort of what is the math side of things, is OHA using a population-based metric when it comes to allocation now, or is it really just somebody at OHA? I mean, like how are these decisions about allocation getting made, and what's the formula?
Amelia, I can answer part of that question. Local public health and health systems have conversations with OHA, and we're able to voice what our needs and concerns are. We aren't party to every discussion and the lead up to decisions. So I think as far as the current distribution plan, the allocation decisions, I think those questions are probably better turned toward OHA.
Rachel, did you have a follow-up?
I did. So do you all at the in the metro area as county and regional public health officials have any insight or, lens into whether the nursing homes and other congregate care settings have been vaccinated yet, given what else you're saying about the shortage of vaccine in the area?
So Rachel, the long-term care facilities needs are being met through the federal pharmacy program, which is it's a federal program, and OHA has been collaborating with them. We've had a few reports out on which long-term care facilities are on the list, and some information on dates that they're anticipated to have vaccinations performed on site. We do not have very up-to-date information on that. OHA may have more granular details on that.
So just to understand, so you don't know what the status is at nursing homes and other similar settings in the county?
So I can speak for Clackamas County. I know that we were alerted as to who was on the federal pharmacy partnership, and we've heard from some of our skilled nursing facilities who did not make it on there for whatever reason. There are a number of reasons that might not have worked out, and we've worked with them to find other opportunities and other access. As far as our adult foster homes or other congregate care settings, we do prioritize them and are continuing to work on identifying gaps for those high-risk populations that may not have gotten in to the federal pharmacy partnership or other resources, other access.
And we've been doing the same in Multnomah County. We don't have a full grasp of the total N, if you will, of between the what Dr. Baumann was saying, the federal pharmacy program and all of the gaps, but we are responding to the gaps as people, we identify people and they reach out to us. That's one of the roles that public health does play, is to help fill some of those gaps in pretty high risk situations.
Okay, we're closing in on an hour. And so again, I would ask everybody, I know there are a couple of, I'll let one more question go ahead if somebody wants to jump in, but otherwise please just email Kate and I and or Mary Sawyer or Kim from Clackamas, and we will try to answer you in writing. But we have time for one more question as we close in on almost an hour.
I'd love to take the question. You guys had mentioned earlier that one solution would be potentially giving the metro area more vaccines than are currently coming into this area. Have you asked OHA to give this area more vaccines? And if so, were you denied?
We have talked about that as an option. I have not received an outright denial.
So you're waiting for an answer?
We're in discussions.
Okay, thank you.
I really want to thank everybody who's patient, very complex, obviously people who are very busy. So I really want to thank Public Health Director Jessica Guernsey, Regional Health Officer Dr. Jennifer Vines, Washington County Health Officer Christina Baumann, and Clackamas County Health Officer Sarah Present. You guys have been great. Please send us any questions you still need, and we will do our best. But thanks, and stay tuned. And the press release, if you have any questions about that, also follow up.